You have the right to say, excuse me, sir, how did this bill sum up to 100k? You also have the right to receive urgent treatment. I'm like, okay, this person has not paid. Let me go to the ward and ask. I went there and they are discharged that person. We are not illiterate, please. You have the right to say that, oh, please, I need to know the name of this drug that I am taking. Call it DAMA, discharge against medical advice. You can DAMA at any time you want. Now we're going to be talking about the responsibility of a patient. Next month, you're like, you're going, excuse you, who's going to pay for that things they have used previously? Hi guys, welcome back to the channel. My name is Taiwo Black. Yeah, you already know, and if you do not know, that's because you have not yet subscribed to my YouTube channel. You're missing. Okay, subscribe. All right, you guys, I'm here to tell you that as a patient you have rights. A lot of Nigerian patients do not know that they have this certain rights that I'm about to read out to you people. I just want you to know that you have rights. You have certain rights that are under the constitution and they are punishable under the law if deferred. So there are going to be 12 rights that I'm going to be calling out in this video. Yeah, and I'm going to be giving you instances. I'm going to share stories that I have heard and instances that I myself have experienced as a patient and as a pharmacist. Your number one right is that you have the right to relevant information in a language that you understand. So if you speak only Yoruba, you have the healthcare professional ask you for someone who understands Yoruba to communicate some information to you that are necessary. So you have the right to be communicated in any language that best suits you. That's one. Your second right is you have the right to transparent billing. So if you go to the hospital and they just bring 100k bill for you, you have the right to ask, how did you sum up to 100k? Do you understand? You have the right to tell them to break down your bill so you know what each of your treatment plan costs. Anything you have done, instead of just giving you the summation like that, you can request for it to be broken down for you in simpler terms so that you can understand how your bill summed up to be 100k. Okay, so next time I dissatisfied with the bill that was given to you, just know that you have the right to say, excuse me, sir, how did this bill sum up to 100k? Yeah, it is totally your right. The third right I'm going to mention is you have the right to timely access to certain medical information. For example, you went to the lab in an hospital and you didn't see your result, you don't know the outcome of that result, you have the right to request to know the outcome of such result. You have the right to, so far as your information, it's not someone else's information, you have the right to ask and be told also. You know, the one that pains me the most, that you don't know that it's right, that you have the right to your information, your health information. For example, you are giving drug and you just dispensed, you just put inside the dispensing nylon like this. No name, nothing, just one morning, one night. You don't know the name of the drug, you don't know the side effects of the drug, nothing about the drug. You were just giving and you're just taking it. It is wrong. It's your right to ask, why is the name of the drug not on this dispensing envelope? And you have the right to tell them to write it for you, because it is totally wrong to be using a drug you do not know the name. Because peradventure you even react to that drug, you will not know except you use it and you have reacted. Imagine when you can just see that, oh, this is maybe a sulfonamide and I react to sulfur drugs, please can you change it, something like that. So it is totally wrong to be giving drugs without having the name written on the drug. It is your right to know the name. I see in hospitals they will just put the tablet inside the dispensing line and just put one morning, one night, or one morning, one afternoon, one night. Name of the drug we don't know. And we find people coming, oftentimes patient come into the pharmacy with that nylon and say, oh, please I want to buy the drug. What's the name of the drug? I don't know, you just gave me in the hospital and you didn't ask what the name of the drug was, you're just taking it. We are not illiterate, please. You have the right to say that, oh, please, I need to know the name of this drug that I am taking. If you go to any pharmacy and you are giving that kind of drug without the name written on it, it is flop. It is totally unprofessional. A well-learned health professional will not have any problem disclosing the name of the drug to you. I don't know why they do that, but it is totally wrong. You should know the medication that you are about to be given. Peradventure you react to it, it's your right to know. Okay, so next time someone wants to give you something and they are trying to idle, I'm not telling you, just know that person is a professional, because I've been attended by professionals and I know, and I myself am a professional and I know how much information I disclose on a drug, just so that you can have, you know, a very good understanding of the medications you are taking, good explanation. You have the right to ask, oh, are there any side effects, are there any adverse effects I should know about, what's the name of this drug, when is it expire, anything you want to know about the medicine you are taking, you have the right to ask. Okay, thank you. Another right that you have is that you have the right to be treated irrespective of your gender, your ethnicity, your religion, your whatsoever. You have the right to get treatment. Another right that you have is that you have the right to privacy and confidentiality of your medical record. So in any way your medical record leaked and people start talking, probably you went for an HIV, although it doesn't even happen, but eventually it happened, because I saw a blog where someone had a particular disease, and person got home and someone else called and said, oh, I have this drug for this disease that you have, and it's like, how did you get to know? Then the person went to the hospital and laid complaint. They said, oh, maybe one of the staff must have leaked out the information to some of the reps. I read it somewhere. So you have the right to privacy and confidentiality. If it is broken, then you have the right to sue. You also have the right to receive urgent treatment in the case of emergency. If you are turned back in an hospital without being attended to or without being properly referred to another hospital, then you were denied treatment and your right has been broken. So yes, you can pursue legal suits for that. Another right that you have is that you have the right to reasonable visitation. Peradventure you were admitted in an hospital, you have the right to be visited by people according to the hospital rule, of course, but you cannot be totally denied of visitation. Another right that you have is that you have the right to decline medical care, of course, when you have been told the consequences of those actions. But you have the right to say, oh, I'm not more taking treatment in this hospital. They call it DAMA, discharge against medical advice. You can DAMA at any time you want, but be careful, because you can collect sometimes. Some hospitals are 1 year gone, You cannot, most times, especially in this Nigeria, probably you were dying, you needed resuscitation, and they resuscitate you over the night, and next morning you're going, excuse you, who's going to pay for that since they have used previously? Yeah, you have the right to say you are going, but you also have the responsibility. We're coming to responsibility of a patient. You can decline medical attention against medical advice, but you must pay for it. Okay, thanks. You have the right to quality care in accordance to proper standards. You have the right to be properly taken care of irrespective of who you are or where you are from. Nobody should be more taken care of than the other. Everybody should be equally taken care of, because lives are equal. They all matter. You also have the right to complain or show dissatisfaction regarding the services, the way you were attended to, and the services that were given to you in the hospital. You also have the right to decline or consent to medical research or clinical trial. It's your choice. If you want to participate in it, fine. And if you do not want to, if let's say you went for a breast examination and a lot of maybe students there are a lot of students and they want to touch, feel it, although they are doctors, but you have the right to say no, and you want just your doctor to touch you and participate in any research whatsoever. You can consent to it or decline. It's your choice as a patient. And yes, as you have right, you also have responsibilities to discharge in the hospital. Your number one responsibility as a patient is to treat all hospital staff with respect and dignity. As much as you are going to be treated with such, so also should you be treating your health professionals with respect and dignity, because there are some people that just come and pour aggression, especially in the pharmacy. Oh God. It's not, because as a pharmacy you have to have self-control. That's supposed to have been happening, but it is just know that it's your responsibility. I think as much as they are health professionals, they are also human beings. They left their home just like you left your home. They probably are not eating breakfast just like you have not eaten breakfast. So we're human beings. The only difference is we're on the other side. So please treat every health professional with respect and dignity. Because to be honest, you go collect. If you give some medical practitioners anyhow, you go collect too. Forget patient rights, patient bill of rights. Okay, yeah. So another responsibility as a patient is to make payments where applicable in the hospital. Please pay your debt. I don't understand how some people say, oh, it's an emergency. Okay, who is paying? Because I work in an hospital and people say, oh, emergency. I'm like, we in the pharmacy, because we're held responsible for any drug that is not paid for. Imagine them always removing certain amount from your salary just because it was an emergency. I know from the outside it feels like, oh, these people are wicked, they did not attend. But to be honest, if you are working in an hospital and a certain amount is being deducted from your salary that's not even really consistent because we're in Nigeria, you're going to find it difficult to give drugs on credit. And even in emergency cases, yes, we all have the right, but please bring someone that's going to pay, or bring a collateral, something, or I don't know, because it has even happened to me personally, right? There was an emergency and I was one on this, and like, oh, give me this, give me that, give me that. They rushed. I said, who is paying? Who is paying? Don't worry, we're coming to pay. The husband, I'm coming, but just give them, just give them. So I gave them without the person paying and any of that. I didn't even have the time to put pharmacy debt on the patient's file. After some hours, I'm like, okay, this person has not paid, let me go to the ward and ask. I went there and they had discharged that person. I don't know why and how they discharged, but the person had gone and the bills were on me. So imagine it happened second time. Please pay your bills. Please, I beg. It's your responsibility as a patient. Pay your bill as when due. Okay? Another responsibility you have as a patient is respect the competence of health workers. You cannot see someone wanting to give you maybe a certain infusion, like, oh, no, I don't like that one, give me this one. You have to respect that for them to be there, they are competent of that job. So allow them do their job, okay? Responsibility you should know as a patient is that all treatment modality has a risk. Another responsibility that you have as a patient is be punctual. Please be punctual to the clinic or to the hospital as I went to. If they tell you antenatal is by 10, please be there by 10. Don't start coming by 1 and start saying, oh, these nurses are wicked, they did not even answer me, I waited and waited. You have to be punctual. It's your responsibility as a patient, okay? You take necessary preventive measures in case of infectious diseases as asked by your health practitioner. So if they say you should wear a nose mask, you have to wear a nose mask. If they say you should stay a certain distance, please do listen to your health practitioner. So these are some of the responsibilities and the rights that you have as a Nigerian patient. So the next time anybody wants to try any rubbish with you, it is under the law and it's punishable by the law. You just have to find a very good lawyer, honestly. But if you don't fulfill all righteousness, nothing's gonna happen, okay? So I hope next time you visit an health institution or a facility, you know your right as a patient, so you are not tossed, just anyhow. And also don't forget your responsibility as a patient. Yeah, this brings us to the end of this video. If you've enjoyed it, leave a comment, leave a like, and you share, subscribe if you have not. I would want you to join this family, honestly. And if you've been watching for so long and you've just decided not to subscribe, well, one day you will, okay? One day you're gonna subscribe. So thank you for watching. I'll see you in my next video. Bye.